value is more than just a great price. That's why this segment is brought to you by Pick n Pay.
Thanks so much, Ewan. Well, Nordia didn't tell you that I actually went to watch the movie with him. So I was with one of those 100 girls that went absolutely crazy for that romantic comedy. Definitely a movie worthwhile seeing. Now, talking about seeing, it is Eye Awareness Month until the 17th of October. And Franca Katz is here to give us more advice on taking care of our eyes. Good morning. Nice to see you again. It's Eye Awareness Week. Every week we're discussing something different. And a lot of people have been asking on Facebook, what's the difference between pink eye and a sty?
All right, pink eye is normally the term used for any infection or allergy that causes you know, you have a membrane over the part of the eye that you can actually see, the eyeball that you can see, and that membrane, when it gets inflamed, it becomes very red. And then people refer to it as, I've got pink eye. It's actually an inflammation of that membrane, which makes it so pink and red. But it can be caused by either bacterial infection, a viral infection, also allergies. Yes. So when you have pink eye, it doesn't mean it's always the same. Could be one of the three things.
If people get near you?
The viral one, very infectious. Don't, you know, just keep your distance. If you shook hands with somebody who's got pink eye, go wash your hands, because it's very, very contagious, yeah.
And then what about foreign objects? I mean, I'm often sitting in makeup and then I accidentally get mascara or eyeshadow in my eye.
Yeah, foreign objects, you know, if it's an eyelash or something that you feel some dirt or a little bit of sand or something in the eye, please, the first thing, do not try and take it out with any object, whether it's a cotton bud or anything. Don't go and try and take it out.
Because, you know, we all do that.
I know. Please don't, because you can actually damage the eye in that way. What you should do is just some lukewarm water, just wash the eye out, or if you've got saline solution, you can use that. If you don't get it out, go see your doctor immediately. If it's something like metal, you know, people that are grinding or, you know, doing something where you get little splinters of metal or wood, and that goes into the eye, go straight to your doctor, because that can damage the eye, you know, eyeball and the outside of the eyeball. So, but if it's just an eyelash or a bit of mascara, just rinse it out. But please don't try and take it out with something.
Now, my friend Janet has this habit of, she wears contact lenses. So what she'll do is she'll take her lens out, she'll put it in her mouth if she can't find her solution, and puts it back in her eye, and it absolutely freaks me out.
It does. And the problem is, you know, when you wear contact lenses, and I do as well, so I know sometimes you're somewhere and you just don't have your solution with you, and the contact lens is irritating, or sometimes it actually wants to come out. Yes. And it falls out, and now what do you do? Yeah. People tend to do the first thing that comes to mind is just wet it, you know, and put it back in. But that's the way, we've got bacteria in our mouth, you know, so doing that, you can, you know, open up a problem with eye infections. Yeah, it's a no-no. Also, try not to share makeup with your friends, because they could have used an eyeliner or something, and there was an eye infection. They might not have one immediately at that point, but the bacteria could have been transferred to the makeup, and then you borrow her makeup and use it, and that's how you get an eye infection as well.
Now, if I pop along to Pick n Pay Pharmacy and I want to get some multivitamins for my eyes, or some nutrition for my eyes, is there anything available?
Yes, there's quite a few products where you can actually ask for an eye care vitamin that has got the vitamins, which is vitamin A, antioxidant like lutein, zinc. Those are important things for the eye care and to look after your eyes. They've got it in a combination where you can get all of it all in one box. And just to remember that it's quite weird to think we need vitamins for our eyes. But the main thing is that now you might not need it, but a lot of people suffer from age-related macular degeneration, where once when you're much older, you start losing your sight. And by taking those vitamins now, you are preventing and reducing your chance of getting macular degeneration 20, 30, 40 years from now.
Well, Franca, thank you so much for joining us on eXpresso, making us aware of our eye care needs. If you've got any eye care questions, post them on our Facebook page, eXpresso Morning Show SABC3. It's now time to go over to the Good Hope FM team to find out what's happening in their world of sport.
Stay with eXpresso and SABC3.